it's Dr. Pat with Little Critters, and we have Tortosaurus Rex with us here today. A beautiful 5-year-old desert tortoise. She's a female. You can see the flat plaster on her lower shell. And she presented today because the owners noticed she has some swelling under her skin. If you look at her leg, there's pushiness here, kind of all around her legs, by her head. And very importantly, if we look at her back legs, you can see some significant swelling back here, and you can see some wounds where the skin, because of the swelling, is rubbing on the plastron. And so she's getting wounds on both sides as well. So this swelling is edema, and edema can occur from multiple causes in reptiles and in small mammals. So you can get metabolic changes, like kidney or liver disease, that could result in that. We can have protein loss from primary GI problems that can cause low albumin, and we can get edema. And we can also get parasitic infections that can cause some metabolic changes as well. And this girl, we did do coelomic or body cavity x-rays on, because she is a girl, and we always worry about our girls having eggs, although usually not quite this early. And I see a ton of foreign body ingestion in tortoises because because tortoises tend to eat everything they can. And so it's very common for tortoises she likes to be held like a baby. Very common for tortoises to ingest things in their environment or yard, and that can create problems. She also presented for inappetence. She isn't eating. She's more lethargic than normal, according to her owners. And then we've gotten some complete blood work on her as well. But we're going to give her a little bit of a break. She's very sweet. Give her a little bit of a break, and then we'll show you her x-rays. And we're going to try to get everything figured out so we can get her on the mend. But right now the primary concern is the edema and potential protein loss and determining the cause of that. Okay, so we're looking at her x-rays now, and this is looking straight down. This is the whole coelomic cavity, and what we see here is significant. And we have a round stone-like density right in the middle of her body cavity. And if we go to the side views, it's a little less distinct, but it's still there. So you can see it right here. There's some fecal material in there as well. Her lungs are at the top up here. And this is a side view, so it's altered a little bit. But this is a bladder stone. And bladder stones are very common in tortoises. We see them very frequently. This one is quite large, can reflect chronic husbandry problems like dehydration, nutritional imbalances, but this will require surgical removal.